Developmental milestones are skills that most babies are able to do by a certain time. Examples of developmental milestones are holding the head up, rolling over, grabbing at objects, following objects with the eyes, and smiling. Like building blocks, each milestone lays the foundation for the next. If a baby is having trouble with a certain milestone, this can affect future milestones and cause delays. Your pediatrician knows when certain milestones should be reached. Milestone charts can help you know and track your baby's progress with their milestones. Here are some examples. This Cleveland Clinic developmental milestones chart shows that by 3 to 4 months old, a term newborn should be able to hold their head up unsupported, roll from back to side, babble, smile, and coo. This particular chart goes from 3 to 4 months to 6 years. There are a number of printable charts you can access online. Here's a developmental milestone wheel from Help Me Grow. The milestone chart from the American Academy of Pediatrics healthychildren.org site, and the milestone moments from the CDC. The CDC also has a CDC Developmental Milestones Tracker app for your phone. As you can see, there are many options for you to retrieve a developmental milestone chart for your baby. Milestone charts reflect development for term babies, starting from their birthday. If your baby was born premature, you must correct your baby's dates. Instead of starting the chart from your baby's birthday, you will start on your baby's 40-week due date. This corrects your baby to term. Once your baby is corrected to term, the developmental milestone charts will accurately reflect how your baby is meeting their skills. You will use the 40-week corrected age until your pediatrician says otherwise. Severely premature infants usually need 2 years to catch up developmentally with a term baby that has their same birthday. Once your preemie turns 2, you no longer need to correct the dates. You can then follow the milestones from your baby's actual birthday. At discharge, the NICU social workers may offer you a referral to Help Me Grow Bright Beginnings. This is a voluntary service available to most NICU babies. The goal of the program is to monitor your baby's growth and development, making sure that they meet their developmental milestones appropriately. For further information about Help Me Grow Bright Beginnings, please see our NICU social workers. NICU follow-up clinic is for those preemies born very small or very premature, or any infant needing close observations of developmental milestones after discharge from the NICU. For those parents whose baby will follow up in the NICU follow-up clinic, the NICU social workers will continue to be available for support, resources, and referrals.